CF is a hereditary genetic terminal disease that affects the respiratory system and the digestive system. The lungs produce too much thick mucus and it's really hard to cough up. The pancreas doesn't make enough enzymes in order for us to digest our food. So a lot of people with CF have trouble gaining weight, things like that. I was diagnosed with CF when I was 14 months old. I was very sick as a baby, so my mom took me to a lot of different doctors, and so one doctor recognized my symptoms. He referred me to a doctor that specializes in people with cystic fibrosis. So when they took me there, they did a sweat test to diagnose me and confirm that I did have CF. I've always known that I've had CF, and I don't remember ever being specifically told that I had it. So it's just something I've grown up knowing. Growing up with it was kind of hard. I was picked on a lot for coughing and different things. It was hard for me to keep up with everyone else in gym class because of all the coughing and just getting tired more, because it's a lot like asthma. And I have asthma too. And I never let it stop me from doing normal things when I was a kid. I always rode my bike still and roller skated and played with all the other kids and did all other little kid things. I missed a lot of school when I was a kid because of being in the hospital when I was sick. I would go into the hospital usually once or twice a year, and I would be there usually 10 days, sometimes 10 to 14 days. And as I've gotten older, being in the hospital became more frequent. So usually it went from like 2 to 3 times a year. Now it's a little more than that. And the amount of time became more being in the hospital. I went from going in there 10 days to 2 weeks, 14 days. Now I'm up to usually going in there for like 3 weeks at a time. So it's really not any fun anymore. When I was younger, I really liked being in the hospital. It was kind of a vacation for me, being out of school, and just because I goofed off a lot being in the hospital with all the other kids that had CF. When I was a teenager, I still did normal things, hung out with my friends, went to parties, did all those teenager things, and graduated high school, just like everyone else, got my license, but I decided not to go to college for a lot of different reasons. Mainly, I think because I didn't want to waste my time, because I knew I wouldn't be around forever. So I didn't want to waste 2 to 4 years of my life in school for something that I probably wouldn't wind up doing. So I just wanted to have fun. So I started working. I did a lot of different jobs. I like to job jump and get different experiences. I never lost a job due to having CF. They were all really understanding with me being in the hospital. When I say that going in the hospital because I was sick, I mean that I have lung infections, which are usually a form of pneumonia. And what they do for me in the hospital is I get IV antibiotics and chest physical therapy. And that's when a respiratory therapist would come into the room after I did my regular nebulizer medicines, which are inhaling different medicines. And they would come in the room and beat on me. That sounds great. But they would just, you sit on the bed and they just beat on you like that, and it helps to loosen up all the mucus and cough it out better. And then they usually once or twice a week I would go down for pulmonary function tests, and what that is is you pretty much just blow into a machine, and that measures your lung capacity and the percentage of what you're able to push out of your lungs. Normal people, I think, are supposed to be like probably 100%. You're supposed to be able to use your lungs 100%. As I've gotten older, mine's gotten down a lot. I think mine's 30 or 40% now, so it's not great. Like I said, I've never stopped CF from letting me do what I wanted to do, mostly because having it, I know I'm not going to live forever or live a long life. Life expectancy is around 30 years old now, for most CF patients anyway. I remember when I was younger, the life expectancy used to be 15, and then it went up to 20, 21, and over time it's increased because of better medicines. Doctors are more aware of CF and how to treat it, and they can treat it better. So it's really gone pretty far. They found the gene that causes it, so they're working with that. Different medicines. There's a lot of different studies going. Some patients can participate in different studies, just testing out different medicines. I did a couple of them, and I think that worked out okay. It's a hard thing growing up with CF, especially knowing that you have a life expectancy. I mean, everybody grows up knowing that, yeah, you are going to die, but when it's put right in front of you, that you have a certain amount of time, it's a little harder. So you do want to go out and have fun, and that's what I did. I didn't really think about it much, though, when I was really young. It wasn't really until I got older, probably my teenagers, late teenagers, when I started noticing more of my friends that I had with CF, they were dying, and they were dying young. 20, 21, around that age. So that was really scary, and that was one of my decisions of not going to college, because I didn't want to go to college and then what happens to me then? I'm going to die because everyone else is. So I just wanted to have fun, enjoy my time the way I want to. So I worked up until last summer, and I stopped working. I started to get really sick, and in September of 2000, I got very sick, and I went into the hospital, and I wound up being there for 3 weeks. That was one of the first times that I was ever in for longer than probably 16 days. I think before that, the longest I had been was like 14 to 16 days. So it was definitely a really long time for me to be there. And when I was discharged, I still didn't feel very good. Usually when I get out of the hospital, I feel great. I feel really good. Go back to doing everything I really want to do, and go back to work and do everything. But this time, I didn't. I felt not great. Usually, I felt good. So I was home when I was discharged, and I was home for 2 weeks. And after that 2 weeks, I wasn't any better. So my fiance brought me to the emergency room, and when I walked into the emergency room and into to the door, and when they took me back there, they took my oxygen level, which they put your finger in a little thingy, and it measures the amount of oxygen, percentage of oxygen that's in your blood. And for normal people, it's supposed to be 100%. So most people run 99 to 100%. sometimes a little lower, depending if you smoke or whatever. So mine was 46%. I usually run, well, before I started wearing oxygen and before I started getting sick, I usually ran anywhere from 95 to 98%, which is really good. So when I went in and they took it, it was 46%. If your oxygen is 46%, you're really not supposed to be able to walk or much less be talking to people. But I was. Really, at that point, my body should have been incoherent or passed out, but I wasn't. Apparently have a very strong will. So that was really, really scary. That led me to another wonderful 3 weeks in the hospital. They did my normal thing, the IV antibiotics, chest therapy. The only thing really that they did differently that time was I went for a bronchoscopy. Excuse me. Where they go through your nose. Sounds really gross, but I wasn't awake when they did it, so they take a small spaghetti-like tube and they go through your nose, it goes down your throat, through your voice box, and into your airways in your lungs. And they're able to look in your lungs and see what's going on in there, see if there's anything really bad. And so they looked around, they saw like normal scarring of the lungs that's typical with CF patients. And then they were also able, when they go down there, to clean it out. I guess they basically drown you while they're in there, squirt it down with saline and suck all the junk out. So after that, I felt better because my lungs were cleaned out. So I felt better, and I was only in the hospital probably another week after that. They sent me home. I was sent home to wear oxygen 24 hours a day. So I've been on oxygen since November, 24 hours a day. So that's kind of hard too, because I have to, when I go out in public, stores or whatever, I have to drag my oxygen with me. That's kind of hard, because I get a lot of stares, because you're not used to seeing somebody so young with oxygen, so that gets a lot of looks. I'm not very comfortable with it all the time. And it doesn't bother me because I was always used to people staring at me because of coughing, but I think it's a little different now because I'm more conscious of it. Whereas if I'm out and I'm coughing somewhere, I never think twice about it because I'm so used to it. So, so in November I finally got out, and I did okay up until January, where I started getting really, really sick again. This time I started getting really sick. Wasn't good. I started losing my appetite. I was too tired to do anything. Wanted to sleep all the time. And another thing, I was sleeping during the day a lot. That's something I never ever do. And I was getting sick. I was going down fast, and I was really scared about it. Didn't go unnoticed by my fiance or my family. They were really worried, but I just kept thinking, I'll be okay. In another few days, I'll be okay. I'll be okay. And that's an excuse I use a lot. You know, just give me another few days. I'll be okay. Well, those few days never came until February. And February 10th, my mom brought me to the emergency room again. It was a bad one. The day that she brought me there, I was to the point where I would walk from my couch to like another room, which is like maybe 10-15 feet, and I would have to sit down and rest because I was so out of breath. Couldn't breathe. It was horrible. It was really bad. Scary. And so when they brought me to the ER, I was hospitalized again, and little did I know the most scariest and challenging for me, both mentally and physically, and probably the most traumatic for my whole family and all my friends. I was really faced with more issues than I think I wanted to deal with, but I did. So what happened to me there was the 10th was a Saturday, I believe, and my mom brought me to the emergency room. They was brought back, you know, I was there, they did their thing. They brought me to my room. I was alright until the next day. And the next day was a Sunday. So I was fine until Sunday night, when I started getting really, really sick. I remember it was really late. It was probably around midnight or so when I started to get bad. I remember being in bed in the hospital, and I couldn't breathe at all. So I called the nurse so they can get somebody down there to my room to give me a treatment, which is just my regular inhaled medicine that, like Ventolin, and it opens up your airways so you can breathe. So they sent somebody down to give me that, gave it to me, didn't work, I still couldn't breathe. They gave me another one, I still couldn't breathe. My oxygen level was dropping really low. I wasn't doing anything. It basically got to the point where it was so low, they gave me a choice. You know, we can take you down to the ICU and we put you on a ventilator, or not, and just see what happens from there. I went on the ventilator. I vaguely remember going down there. It was just going to be really scary, I know that. They called my mom. My mom called my fiance, and they came down to the hospital, and that must have been around 3 o'clock in the morning. They got there right before they put the vent in. My mom, my fiance, and my dad were told that I might not make it out. So everybody was, I don't think everybody was, but they knew that I might die. The only thing is, I don't think I knew when they told me they were going to vent me. At the point I was at, my oxygen level was so low and my carbon dioxide level was so high, what happens is, if your carbon dioxide level goes up really high and your oxygen level drops, you're basically going into respiratory failure, and that's what happened to me. So I was so hazy that I didn't realize being on a ventilator meant being on a ventilator, that they're going to stick that tube down your throat. And so I think it was just so hazy for me that I didn't realize how scary it was at the time. Early Monday morning, and only little hours after being vented, they did another bronchoscopy on me. That was my first one since November. And I guess when they did it, they sucked a lot of junk out. They got a lot out. So my time frame for those, because I was ventilated for 3 days, my time frame is all screwy because I was in and out of consciousness so much. A lot of it's all kind of hazy and weird. But I mean, when I was awake, I was awake. But it just, my time frame, I thought I was vented for a lot longer than I was. I thought I was in ICU for a lot longer. It was definitely, I think it was, while I was in the ICU, I think it was scarier for my family and my friends than it was for me. Because in my head, I knew I was going to make it out okay. They didn't know that because I couldn't talk with the tube in. I was able to communicate by writing to everybody. It was definitely an experience that all my friends have said they learned a lot from. You know, you just don't know how long you have and how long your friends have. No matter, I mean, it doesn't matter who they are, really. If you have CF or any disease, anything, you just don't know. And that's why, I mean, I always make sure I tell my family I love them. You know, because you don't know what's going to happen. The next day was a Tuesday, and they did another bronch on me. I was more aware of things definitely that day. So I was really curious about all the things that were behind me and what was going on. Because I was well tubed up. They had lots of things going on with me. It was quite a sight, I guess. And then Wednesday, which was Valentine's Day, they were going to take the tube out. They were going to take it out and see what's going to happen. Again, everyone was told pretty much don't expect her to live, I guess. I don't think they told them that way, but, you know, they were going to take it out, see what happens. I do remember when they told me that they were going to take it out, them saying, Dawn, when we take it out, if it doesn't work, do you want us to revent you? And I guess my first answer was no, because like I said, in my head I was thinking, okay, they're going to take it out and I'm going to be fine. And that's what I believed. I was going to be fine, you know. And I truly believe now that in my head I was thinking, oh, if they're going to take it out and it doesn't work, that's it, I'm going to die. You know, if I kept that up in my head, I believe that's what would have happened. I think me being so positive while I was there, that's one thing that kept me alive. I did have a lot of support from all my friends and my family. That's a really important thing, to be very supportive of somebody who's really sick. So, Wednesday morning, right before they pulled it, I know they didn't tell me what they told my family, you know, that I wasn't expected to make it out. So one by one or two by two, whatever, all my friends and family that were there came in, basically, I guess, to say goodbye to me, which I didn't know. I mean, I knew they were all coming in to see me before they took the tube out. But everybody was there. And then when they pulled the tube out, I was fine. I was able to breathe and everything okay. I mean, they had an oxygen on. The only thing that they did put on is a machine I wear every night now when I sleep. It's called a BiPAP. It's basically just this little nose piece, goes over your nose, and it forces air into your lungs. Well, you obviously have to breathe through your nose. So when I breathe in, it forces more air in, and it also helps to relax your diaphragm, because before I went in the hospital, and while I was in the hospital, my diaphragm was so overworked from breathing so hard and so fast all the time that it just needed a rest. So I was on that as soon as I got off the bed, and I was fine. I was in ICU 2 more days, I believe, and they finally brought me back to my regular room on my regular floor. Also, once I got back to my regular floor, once I got out of ICU, really, it really hit me. I think because I was more aware, and I was finally off all the drugs that they were giving me in ICU. I was more aware that, yeah, I almost died. So I have, the first week out of ICU was, I think, more scary for me, because I was faced with more realities than I was ever. You know, realizing that I have to make more decisions about my life and what I want done with things, more realities than a normal person my age should face. It's definitely scary now when I think about it, but I'm very glad I made it out and I'm okay. I definitely still, you know, just live day by day. Try not to get the stupid things get to me. And I'm, you know, very happy that I have great friends and family that are very supportive. Once I got back up to my floor, I had to work on getting myself back to normal. Definitely gaining back weight I lost through that whole time from like January to even I think way before January. I had lost so much weight. I lost like 20, 25 pounds. I had to work on getting my weight back, getting my strength back, endurance, everything. I was told that just laying, if you're sick or whatever and you're laid up in bed for just 2 weeks, you lose 80% of your muscle. And that's what I did. I lost so much muscle just from a few weeks of being homesick and then being in ICU, really doing nothing. I lost a lot. And once I got back to my floor, I still wasn't moving around at all because I was just still exhausted from being in ICU and being sick there. I wasn't moving around at all. Gradually I started doing little teeny things, and I was, at that time I was in the hospital, I was in there for a month, and a week before I was to get out, they started sending me to physical therapy, where I would do more walking and exercise bike, to get me going again, because if I didn't get going again, the same thing probably would happen, because you're not moving, everything's just sitting in the lungs, not getting out. It's not good. I didn't go home right away. They sent me for a week to a special hospital, that it's a rehabilitation hospital where they do physical rehab. They have a program for pulmonary rehab, and that's what I did. It was really, really helpful. It was still just a week of doing different exercises to getting strength back, endurance, getting back to where I kind of want to be with myself, my health. I learned a lot of different things, different breathing techniques, which is really, really helpful. Mostly because when you tend to get out of breath, you breathe hard in and out of your mouth, and that's the worst thing to do, which I wish I had known that way before, because I probably could have used it. It's really just breathing in through your nose and out through your mouth, and that helps a lot. So I was there a week, and it was really helpful, and I just could not wait to get home, to get back to normal, or kind of normal. It was nice to get home. It was weird, because now that I'm not sick anymore, or as sick, it's really hard being home all the time, especially not that because I can't work. I've always liked to work because it kept me busy. So now I'm home all the time, and it's boring. But I just have to keep staying positive. I don't want to dwell on things. I know it's hard. A lot of things that do bother me when I go out, just the people staring. And some people are just rude about it. And just definitely the hardest thing is just being bored all the time. It's so easy for everybody else to say, well, you can go find something to do. Well, what am I supposed to do? Walk around the mall all day? No. It's hard. I just have to stay positive, and I'm very thankful that I'm still here and enjoying every day as I see every day come. And I think that's about it. I'm going to show you some of the stuff I do every day, some of the medicines I take every day. Pill-wise, I don't take a lot. The only things I take, my own multivitamins, allergy pills, and the medicine I take before I eat to help me digest my food. The other medicines I take are breathing medicines. I'm sure you've seen like inhalers. I don't do inhalers really. I have one I carry with me just in case. The ones I do one, it's a mixed one, which is a bronchodilator. When I breathe it in, it helps expand all the airways in my lungs so I can breathe better. Another one I do is a fairly new one, and it's probably one of the best ones they've come up with. It's called Pulmozyme, and what it does is when you breathe it in, after amount of time of you doing it, it's not something that works instantly. It helps mucus in your lungs to be thinner, so it's easier to cough out. It's not so thick and gross as it used to be. It's much thinner and easier to get out. Another medicine I do is just an antibiotic, inhaled antibiotic. And I just do these. The bronchodilator I do 2 or 3 times a day. The Pulmozyme I do once a day. The antibiotic is twice a day. So I spend a lot of time doing my medicine. In the morning, I do all 3. It's usually a good hour, maybe a little less. I I have it all set up in front of the computer, so it's a little more entertaining, because when I was younger, I used to not do a lot of them. I really hated doing them for many years. When I was a late teenager, my early 20s, I blew it off a lot, and which is really stupid of me then, and I regret it now, you know, because when I was a teenager, I put other things ahead of my medicine and my health. You know, I put having fun more in front of them, which was stupid, but yeah, obviously learn from your mistakes. That's why for medicines, I really don't take a huge amount of medicines. I'm going to be taking another antibiotic as soon as my doctor calls me, because I'm starting to feel icky again. And the oxygen 24 hours a day. I sleep with it. I don't sleep with this part on. I have it just goes attached to my BiPAP. I'll show you the BiPAP machine. It's a funky looking little thing. And that's about it. Just my oxygen. I have like little oxygen tanks that I bring with me when I go out to the store or whatever. It comes in like a little backpack. And I will show you my oxygen tank. That's my oxygen tank. That's the one that runs 24 hours a day. It's not very noisy. It's nice and quiet. Just stuck there, out of the way. The BiPAP machine. I attach this tube to my oxygen, and this is the little headgear I have to wear. And turn it on. And that's what it sounds like. Just a bunch of forced air. It's really not uncomfortable to wear. Nebulizer machine. It's basically just a small air compressor. I hope I taught you a little about CF. There is a lot to know though. I couldn't tell you all of it. I don't think I have enough time on this tape to tell you tons of stories I have about being in the hospital, and some of the things I did there that I'm well known for. A lot of people with CF are well known in the hospital for being pranksters and goofing off. Definitely couldn't tell you enough. There's a lot of different websites to go to learn more. The cysticfibrosis.com is one of them. There's other books out there to learn more. It's definitely something everybody should be aware of, because you just never know if you could have a child of your own with CF. Okay, thanks. Bye.